Hi guys, welcome to Sexual and Reproductive Health Corner with Dr. Ifnai Lady. If you are new here, I raise awareness on issues concerning women and children. Today we'll be discussing some home remedies that can help you to alleviate fever in your child. I'll also give you some tips on what to do if your child starts having convulsion during a fever episode. And of course, ways you can prevent sudden rise in temperature to avoid such convulsive episodes. So please stay with me. Because children are small, they cannot talk, they cannot communicate what they are feeling. It is our duty as parents to be observant, to feel our babies, to know when they are having fever. So if you always observe your child and you notice that your child's body is getting hot, maybe touch the forehead, touch the chest, and you notice that I think that this baby, the temperature is changing, it's not what it used to be. So the first thing you need to do is to get your thermometer. Of course, I've always said this severally, that you need to have a thermometer at home if you have a child that is less than 5 years old. So you get your thermometer and check the baby's temperature. You can put it in the mouth or in the armpits, but it's best to put it in the mouth. When you check the temperature and the temperature is above 37.5 degrees, there are a few things we can do to prevent this temperature from going higher. Or if the temperature, for instance, is up to 38 degrees, there are things you can do to bring this temperature down and prevent it from getting. What you will do is to remove all the clothing this baby has on. So as the baby has an innerwear and a shirt or a t-shirt and a trouser or a short, you need to remove all of them. Remove the cap, remove the shirts, remove the singlets, remove the undies. You can leave the baby with just a diaper. Then the second thing you will do is to put a lukewarm water. How to mix a lukewarm water is to get a cold water and then put a little bit of hot water in it. It's called lukewarm water, a water that is neither hot nor cold. So when you have mixed this water and you feel it and know that, okay, this water is neither hot nor cold, you are going to use a towel, a face towel, to soak the towel in the lukewarm water and place it on the forehead of your baby. And that's it, you need, and leave that one there. Another one you need to do is to wet the baby's hair, make the baby's hair wet so that it can last few minutes. Then use another towel to start sponging the baby's body. For babies that are less than 2 years, that are still small in size, I'll usually advise the parents to bath the baby. Just mix the lukewarm water and use it to bath the baby. After you finish bathing the baby, bring the baby out and then use the towel that you have soaked in lukewarm water to start cleaning the baby's body for up to 15 to 20 minutes. This really helps to bring the fever down. It works very well. I've done it, my patients have done it, and I know it works. But it requires you to put in energy and time in doing it. It's not something you are going to rush and get results. So another thing you can do after you have done this is to give the child paracetamol, acetaminophen or ibuprofen. If you are giving paracetamol, you are going to give the child paracetamol every 4 hours, but if you are giving ibuprofen, it should be every 6 hours. For the dosing of the paracetamol and ibuprofen, please, at the point of purchase in your local pharmacy or in the chemist shop, please ask the pharmacist there the dose you give to your child depending on the weight. It's not something you can calculate here. Okay, so when you have done this, you have to wait for like 30 minutes and check the temperature again. If it's still high, you need to repeat the sponge, like using the lukewarm water to clean your baby's body. over and over. You can repeat this process so many times. If at the point of checking your baby's temperature, you notice that the temperature is above 38 degrees, you have to do all these things: removal of the baby's clothes, sponging the baby, like clean the baby's body with lukewarm water, and giving a antipyretic like paracetamol or ibuprofen. Then proceed by taking the child to the hospital to be evaluated by a medical doctor. They are going to ask you questions and examine the child and run some tests to know if there is a serious thing that is happening to your child, and they will get it treated. Assuming that you weren't observant enough and your baby's fever rises suddenly, and you only noticed it when the baby is jerking, like the baby is already shaking, jerking, or the eye is twitching, or the baby is breathing fast. This can be sign of febrile convulsion. Febrile convulsion is convulsion that occurs during a fever episode. Sometimes it comes not necessarily because of the level of the fever your child is having, but at the rate the fever increases. For instance, if the fever shoots from, say, 36.4 degrees and then moves to 37.5 and then 38 and then all of a sudden shoots to 39, this baby is likely going to be predisposed to febrile convulsion. So at this point that your baby is convulsing, your baby is shaking, the body is shaking, or is becoming stiff, please don't touch the baby. If the baby is already lying down or you are carrying the baby, don't put spoon inside the baby's mouth, don't put anointing oil inside the baby's mouth, don't put holy water, don't put bobo niche, don't put any concoction into the baby's mouth. The reason is this: the concoction you are putting can easily enter the wrong tract, like enter the tract from where your baby is breathing. We call it the respiratory tract. If these substances enter into that respiratory tract, it's going to shock your baby and your baby will die from it. So it's better you leave the baby, let the baby convulse in peace. The only thing you need to note is the time the convulsion started and the time it ended, because when you take your baby to the hospital, they are going to ask you what happened. Was the baby shaking? Was it stiff? Those are the things you need to observe. And then to know how long the convulsion lasted is going to help your doctor to make some judgments on your child's condition. Things you shouldn't do if your child is having a fever episode. Number one is don't wear extra clothes. Even if the child is shivering, don't put on extra clothes on your baby. Remove all the clothes. Don't put extra clothes on your baby. Don't bath your baby with hot water. It's going to worsen the fever. Don't apply anointing oil on your baby. Olive oil, oil for the sick. Don't apply it on your baby's head. Don't apply it on your baby's face. Don't apply it all over your baby, because it's going to cover pores. You know, the opening on the skin that where heat escapes from the body. That's from that opening that we sweat to. So the oil is going to go and block it, and your baby is going to get stuck with that fever and it's going to worsen. So please don't apply oil, palm kernel oil, we call it udake in Igbo, palm kernel oil, bobo nise, all those concoctions that has oil, don't apply it on your baby. It's going to worsen the fever. Another thing that you don't need to do is, please, if the fever is so high, please don't keep the baby at home. After you have done your home remedy, please take the baby to the hospital, because it can be something else that is happening to the baby and it needs to be taken care of. So, in summary, I'm saying that for you to adequately understand when your child is having a fever episode, you need to be very observant. If it's a child that goes to school, you need to talk to the teacher in school to tell them to observe your child. If there is any changes they notice, they should quickly call you on phone, and also tell them to remove the clothes while they are waiting for you. If the child is at home and if the child is running around, because these children, they can have very high fever and they'll be running around playing and doing everything. So all you need to do is that if the child runs past you, just drag the baby, touch the baby, feel the baby, and allow the child to continue. In that way, you also observe when the fever is coming up immediately. And if you notice it, stick to what we have said. Don't do the ones we ask not to do. Do the ones that is helpful, and then take your child to the hospital for proper examination and investigation. Thank you for watching, and see you next time.